Hi everyone, so my name is Valerie Pulido Castro. I am the team leader for Group 5, and our presentation is going to be about obesity and nutrition, exploring Hispanic and Latino adult health from ages 18 to 65 years of age, and access to affordable, healthy foods in Stanislaus County. So our mission and what we've been doing this whole semester is our group, through several months of research, have been committed to explaining why social determinants of health have contributed and correlated actually to the rising rates of obesity and limited nutrition access among 18 to 65 years of age when it comes to Hispanic Latino adults in Stanislaus County. Forgotten ideas such as lack of informed nutrition education, low wage paying jobs, uneven paved roads, and so much more. Many, many more ideas have contributed to our focused health issue. And oftentimes this is kind of just seen underneath the gutters and it's not really acknowledged. So let us inform you on this.
Nutrition and obesity affect everyone, but Hispanic and Latino communities in Stanislaus County face bigger challenges due to education and access. Education as a social determinant plays a key role in shaping health outcomes. Lower education levels often mean less knowledge about healthy eating and preventative care, which contributes to higher obesity and chronic disease rates. About 13% of Hispanic and Latino adults in Stanislaus County lack a high school diploma. As shown in 2022 obesity graph, 38.6% of Hispanic adults are obese compared to 33.7% of white adults. These disparities show why nutrition and obesity are more pronounced in these communities. Even though 94% of residents have access to exercise spaces, 24% are inactive and 11% face food insecurity. Also, college students often face added barriers like stress and busy schedules, making it harder to maintain healthy habits. Education and access can make it a big difference. This can be through teaching students and residents about promoting healthier food choices, sharing nutrition information, and hosting physical activity events on campus. Also, connecting students to free or low-cost resources like food pantries, the Student Health Center, Student Fitness Center, gyms, and therapists also support a healthier lifestyle. County programs through the Stanislaus County Health Service Agency also provide additional free nutrition and fitness services to a broader community. By improving education and connecting Hispanic and Latino residents and students to these resources, we can promote a healthier lifestyle and reduce obesity in Stanislaus County.
Hi, I'm Eileen Navarro, and I'm going to be presenting the economic stability portion of our infographic. To begin with, economic strain in Stanislaus County directly shapes eating habits and obesity rates, especially for Hispanic and Latino adults. When families must prioritize rent, tuition, gas, and bills, nutrition becomes whatever's cheapest. It goes on the back burner, even when those foods are high in calories and low in nutrients. This economic pressure is reflected in the county's 11% food insecurity rate, which shows many of the residents struggling to consistently afford healthy meals. Because healthier food costs more and expires faster, many adults rely on inexpensive processed foods, fast food deals, or whatever's offered free at school or work. These choices contribute to the county's obesity patterns. Hispanics or Latino adults have the highest obesity rates at 38.6% compared to white adults in Stanislaus County with 33.7%. Economic limitations push families towards foods that are affordable rather than nutritious, and this is visible across multiple ethnic groups, but more commonly found in the Hispanic or Latino groups. Economic stability also affects physical activity. Even though 94% of residents in Stanislaus County have access to exercise spaces, 24% remain inactive because of long work hours, multiple jobs, and financial stress that leaves little time or energy for movement, with 61% of college-age adults reporting significant psychological stress. Economic stress compounds for eating habits and inactivity, increasing obesity risk. Overall, the data shows that economic pressure is not a lack of knowledge, but rather is one of the strongest drivers of poor nutrition and high obesity rates in Stanislaus County. Thank you.
So in Stanislaus County, neighborhood and built environments are crucial since it shapes everyday choices people are able or unable to make to get food around, have physical activity, safety, and transportation. About 65.2% of Hispanics face difficult challenges in facing affordable, clean housing in Stanislaus County. Another one is physically, food accessibility can be restricting. It's all about uncertainty and instability. And by expanding affordable housing, improving transportation systems and expanded routes, increasing food access, investing in undeserving neighborhoods, and supporting seniors and families, the county can significantly reduce health disparities and improve quality of life. Addressing these issues requires collaboration across government agencies, community organizations, and residents themselves. When communities have safe housing, reliable transportation, nutritious food, and functional public spaces, their health outcomes improve, and so does the overall strength and resilience of the region of Stanislaus County.
Alrighty, so the fourth social determinant of health that we're focusing on is social and community context. So while it may come to a surprise to some, actually financial strains and burdens have contributed to the increased obesity rates and limited nutrition access to those in the Hispanic Latino community. From the Community Health Assessment Report of 2025, around 65.2% of Hispanics and Latinos have reported to have access to safe and affordable housing. There's still a good portion that has not reported that safe and affordable housing. And because of this, many have been left with having to budget even stricter with nutritious food products or with whole organic nutritious foods in general, just to make it through each day to afford such expensive housing. And a study was shown that renters are required to have at least an hourly pay of $27.88 and homeowners needing at least an hourly pay of $35.37 to continue having a roof over their heads. And because of this, it's greatly fed into these financial strains and burdens we often see. With such high requirements for home ownership, the Hispanic Latino community in Stanislaus County has fallen a bit short of this requirement. A lot of them don't get paid that much when it comes to the hourly wage to meet that requirement of either the $27 or the $35. And because of this expensive housing, a lot of them have came to mind of this mentality of, okay, now I have to limit budgets for healthier, nutritious food products just to compensate for this increased housing or rent prices that I'm like experiencing at the moment. That's the mentality that's been spread around. Like, okay, I'm going to compensate my healthy food style, life choices, just so I can have this roof over my head because of this increased housing and rent prices. So while struggles exist, many community-based programs are here to support our community. El Concilio is a program well known to help educate and inform many Hispanics, Latinos, adults in Stanislaus County on healthier lifestyles and choices. Market Match is a healthy food incentive program that helps match many residents, such as Hispanic, Latinos, adults in Stanislaus County, to nutrition access and benefits from local farmers market. And while Stanislaus County hasn't produced results based on the WIC nutritional program, their nutritional workshops, educational courses, free health food packages, and food options have supported over 683,000 Hispanic Latino adults in the state of California. That is on average a 74.8%. And actually, because of this program, a lot of adults who benefit from this program have contributed to the lower obesity rates, and now they're like living this healthier food lifestyle and choice.
And for this infographic of healthcare access quality, for the amount of high Medi-Cal reliance that people have, a lot of residents in the Stanislaus County do rely on it, and it is popular. A lot of providers yet do not accept it because it's either going to be a long wait till you have your next appointment, be either language barriers, for example, or high demand of people that need help, and the low amount of doctors and providers that they have is causing a big toll because it's either they get more people to help out people that are in need, or people have to wait forever for their next doctor's appointment. At the end of the day, it just feels like it's creating an unequal access to a lot of people in general. This can be whether certain people are overlooked, whether it's by their race, by their gender, by their economic status. It's a lot of things are usually overlooked when it comes to just healthcare, which is honestly very sad because people depend on this. There is a lot of provider shortages, or because they just don't take Medi-Cal or certain insurance for other people in some cases. This can be a big barrier. Another one I know is a language. It's very hard because maybe either the doctor is trying to translate it and doesn't understand Spanish, so they can misinterpret information, and then they assume that it's one thing, but it's the other, and then it's your health that you're depending on. And the one little mess up in the language can just affect everything. When people are trying to get medications, like this is a big problem. About 44% of Stanislaus County residents speak another language. So this is creating a big language barrier for those that either are receiving the help or giving the help. Last one that I mentioned earlier as well is also a transportation limitations. Like I mentioned, people that live in a household that don't make enough money can't provide for more than one transportation. If the head of the house is working and there's an emergency, they don't have transportation. We also don't have much public transportation, which is a problem because it limits to a lot of help for those in the lower income here in Stanislaus County. And if people don't have the help, they're not going to know where to look or how. These are problems that are affecting people here in Stanislaus, and not only are they affecting them either in a positive or negative way, but this can be a big problem, and many other cities and states and countries are probably dealing with the same thing, if not worse.
So this is our second portion of our project, and it is our photo voice. So throughout the semester, our team has taken the time to really brainstorm photo ideas and locations of where our social determinant of health would take place, considering our health issue of obesity and nutrition access in our Hispanic Latino community in Stanislaus County. So please let us explore together and let us explain to you the meaning behind every single photo that we have taken with our cameras. Alrighty, so this is the social and community context section of our photo voice, and I took 3 photos. The first photo I took are 2 representatives from El Concilio program who actually came to sponsor their healthy food incentive program and many other services that they offer on Stanislaus State University's campus in Stanislaus County. And this is for every college adult on campus. And the second photo is from Turlock's Farmers Market in Stanislaus County, where they offer healthy, organic, and nutritious food items at a lowered price range in comparison to your local community grocery store. And the third photo that I decided to take are 2 Latina nursing students picking extra food products to take home to their families from our local Warrior Food Pantry. And from El Concilio to Farmers Market and even to Warrior Food Pantries, there are many government and social resources ready to help our Latino Hispanic population in Stanislaus County to make better healthy food choices and to live a healthier lifestyle.
Hi, my name is Eileen Navarro, and I'm going to be presenting the economic stability portion of our photo voice. For my photo voice project, I chose some images that show how economic stability influenced the daily food choices and health outcomes of families in San Jose County. In the photos, you can clearly see that the major price gaps between the fresh foods like the produce or the lean meats and the cheaper, highly processed meals. Families who work long hours often rely on quick, low-cost foods because they save time and money, even though they increase the risk of obesity. As the research shows, processed foods are affordable, have long shelf lives, and are easy to prepare, making them the default options for many low-income households. I also included coupon images because they highlight how families often have to depend on fast food restaurants rather than saving for healthy foods. This reflects a bigger issue of economic pressure shaping eating habits. When rent, gas, childcare, and bills take priority, nutrition becomes whatever is cheapest and most convenient. These images illustrate the real-life experiences behind our statistics, showing how economic strain pushes families towards unhealthy diets, contributing to higher obesity rates in our Hispanic or Latino communities. By documenting these everyday realities, my photo voice emphasizes the need for affordable, accessible food, health options in Stanislaus County. Thank you.
Hello, my name is Kevin, and I'll be going over the neighborhood and built environments all around San Jose County. So the first picture, I chose EBT etc. here from Taco Bell because it shocked me to see people potentially spend their EBT balances on highly processed foods and food desserts and food swamps rather than purchasing good, high-quality foods and healthy foods like vegetables, fish, fruits, whole grains, etc. Fast food restaurants are often placed on major roads and corners all around the city compared to grocery stores, or rather farther apart, requiring longer distances, leading into lack of transportation or walking distances. And on the second picture, it was taken in that series, which shows how much attention the pavement actually needs. The sidewalks are flooded around weather like that we have right now, and people need safety and a safe travel to walk to. And despite there being an elementary school right a block away from this picture where it was taken at series called Don Pedro Elementary School. And on the third picture, it's actually San RTA, which offers economic, convenient transportation to those who need it, especially those who need to go to a hospital or a doctor's appointment, which 37.7% of Hispanics are affected by this. And, San RTA offers really, really good, convenient transportation. And, about 5.4% of San Jose County actually lack a vehicle, which makes San RTA very convenient for those who really need transportation. And, they're seen all around San Jose County in big cities like Modesto, Turlock, and Ceres.
So for mine, it's going to be healthcare access and quality. On the left-hand side in that photo, you're going to see a lot of people that are in a clinic or hospital that it shows a big overload or a big population of people in a healthcare office. This just goes to show that in Turlock, a lot of people that are in the middle to lower class, or say they come from out of the country, or they have a part-time job that they can't depend on to get a good insurance for their family. They need somewhere to go to, and they're not getting the healthcare access that everyone deserves. You can see the difference from a hospital with someone that has an insurance versus the difference from those that don't have insurance. The quality and care is a lot better. The people that have Medi-Cal, Medicaid, it's holding a big toll on those that don't have a good access. For example, in Turlock and rural areas, they have a lot of problems because of those that live in, say, like the back roads. This limited public transit makes it difficult for those in low-income families that can't provide, don't have enough for multiple cars in a household or even a car in a household. So this just limits the people either going to get help from either hospital or whatnot. Many households in Stanislaus lack reliable internet or digital literacy or virtual health services that are effective. The quality of healthcare services varies widely. Fragmented care is limited. Coordination between providers can lead to misdiagnosis or medical errors. So it puts a big toll on them because then sometimes you're not even maybe getting checked for the right thing, or what can also happen is you're misinterpreting the wrong diagnosis for the certain individual. This is affecting people in healthcare. The quality on healthcare is like fragmentation on care, the poor coordination between providers, the patient safety and outcomes, like when it comes to hospital clinics, and the performance on the doctors. This can be with race, social, economic status. A lot of factors can be put into this that can affect those that are in need and are looking for that help. This also kind of ties into mental health. Services are usually lower quality, which is very, very, very overlooked, a hard thing to get over, because it's like, are people getting the help that they deserve and that they need at the end of the day? So it's going to make people not want to get help, leading to a ripple effect of problems around Stanislaus County that we've been having.
I focus on the social determinant education, access, and quality, and how it affects nutrition and obesity in Stanislaus County, and specifically in the Hispanic and Latino community. My picture to the left and right show the free health information pamphlets that are offered in the Student Health Center at Stan State. They provide simple information on healthy eating, exercise, and nutrition. Since many individuals don't take many health classes, pursue a health-related career, or simply don't have access to wellness resources, these pamphlets help Stanislaus County adults learn basic ways to make healthier choices and lose their risk of obesity. The middle picture shows a campus poster listing free community food resources like food pantries, community meals, and fresh produce programs offered by the Stanislaus County Health Service Agency. Sharing this information helps people find healthy, affordable, or free food options, which supports nutrition education access. This matters because obesity rates are specifically high among Hispanic and Latino communities in Stanislaus County, partially due to limited access to reliable nutrition information and healthy foods.